P2Y12 receptor antagonists are a critical class of antiplatelet medications primarily used in the management of acute coronary syndrome and during percutaneous coronary intervention. They work by blocking the P2Y12 subtype of adenosine diphosphate receptors on the platelet surface, preventing the activation of the glycoprotein 2B3A complex and subsequent platelet aggregation. While the newer agents have largely superseded clopidogrel in high-risk scenarios, clopidogrel remains the most widely used P2Y12 inhibitor globally. It is an irreversible thienopyridine prodrug. It requires a two-step hepatic conversion, primarily via CYP2C19, to become active. It has a slow onset of action and significant inter-individual variability in response, often due to genetic polymorphisms in the CYP2C19 enzyme, leading to clopidogrel resistance in some patients. The newer agents were developed specifically to overcome the limitations of clopidogrel, offering more potent and consistent platelet inhibition. Prasugrel, like clopidogrel, is an irreversible thienopyridine prodrug. However, its activation is more efficient, requiring only a single-step metabolic conversion. Provides faster and more uniform platelet inhibition than clopidogrel. It significantly reduces ischemic events like stent thrombosis, but carries a higher risk of major bleeding. It is generally contraindicated in patients with a history of stroke or TIA and is used with caution in patients weighing less than 60 kg. Ticagrelor is the first reversible oral P2Y12 antagonist. Unlike thienopyridines, it is not a prodrug. It is active upon absorption. It binds to an allosteric site on the receptor, meaning it doesn't compete directly with ADP, but locks the receptor in an inactive state. It has a rapid onset and offset. Because it is reversible, platelet function recovers faster once the drug is stopped. Unique to ticagrelor are dyspnea, shortness of breath, and transient ventricular pauses or bradycardia, likely due to its interference with adenosine metabolism as side effects. Cangrelor, an intravenous agent, represents the latest shift in the class, providing an option for acute bridge or emergency settings. It's a direct-acting, reversible IV antagonist. It does not require metabolic activation. It has an immediate onset, reaches steady state within minutes, and an extremely short half-life. Platelet function returns to normal within 1 hour of stopping the infusion. It's used during PCI in patients who have not been pre-treated with oral P2Y12 inhibitors or those who cannot take oral medications.